The joy of a newborn baby also includes the overwhelming feeling of love, happiness, and wonder that parents experience when they first hold their new child. Often described as a profound and unique connection marked by the miracle of new life. This video will guide you how to care for a newborn, especially for first-time parents. Always wash your hands before touching the cord. Clean the cord with warm water and mild soap if it's wet with urine. Pat the cord dry with a soft cloth or towel. Keep the area dry and exposed to air. Fold the diaper down so it doesn't cover the cord. Change diapers normally. Don't pull on the cord. Call your doctor if the cord hasn't fallen off after 1 month. If there's bleeding from the cord or the area around the skin. If there's pus, a yellow or white discharge. If the navel area is swollen, red, or painful. If the cord doesn't heal or dry completely within 2 weeks. Within 1 to 3 weeks, the cord stump usually dries up and falls off. As it dries, it shrinks and changes color from yellowish green to brown to black. After the cord falls off, a small pink area may appear in the belly button, but this is normal. On the top of your baby's head, near the front, is a diamond-shaped patch where the skull bones have not fused together yet. There is another, smaller, soft spot towards the back of their head. These are called the fontanelles. It will probably be a year or more before the bones close over. Do not worry about touching the fontanelles as they are covered by a tough protective membrane. At birth, the top layer of your baby's skin is very thin and easily damaged. Over the first month, or longer for premature babies, your baby's skin matures and develops its own natural protective barrier. Vernix, the white sticky substance that covers your baby's skin while in the womb, should always be left on the skin. It's a natural moisturizer that also protects against infection in the first few days. It's best to bath your baby with plain water only for at least the first month. Do not add cleansers to your baby's bath water or use skin lotions or medicated wipes. You can also protect your baby from the sun and treat rashes. Premature baby skin is even more delicate. If your baby was overdue, their skin may be dry and cracked. This is because all the protective vernix has been absorbed before they were born. Your newborn's eyes will be checked shortly after birth as part of their newborn physical examination. New babies can see, but their vision is not very focused. Their eyesight develops gradually over the first few months. Your newborn's eyes may roll away from each other occasionally. This is called a squint and is normal in a newborn. It should go away by 4 months. Talk to your health visitor or GP if it does not. Newborns need special eye care because their eyes are sensitive and still developing. You can clean your baby's eyes with a sterile cloth or gauze and saline solution. You can also try expressing a few drops of breast milk onto a cotton ball to gently wipe the eyes. Redness, swelling, or discharge. Constant tearing. Misalignment. White or grayish-looking pupil are signs of eye problems. Protect your baby's eyes from the sun with a hat or sunglasses. Keep your baby's surroundings clean. Provide plenty of visual stimulation. Show your baby high-contrast patterns, bright colors, and interesting objects. The most common birthmarks in newborns are little pink or red V-shaped marks on the forehead, upper eyelids, or neck. Some people call these stork marks or salmon patches. Marks on the face tend to fade gradually, but marks on the neck can take longer to go away. Dark red and slightly raised strawberry marks are quite common. They sometimes appear a few days or weeks after birth and gradually get bigger. They may take a while to go away, but they usually disappear gradually. Although the cause of birthmarks isn't known, most of them are harmless and don't need treatment. Babies with birthmarks should be examined by your child's healthcare provider, especially if they're located in the middle of the back, along the spine, may be related to spinal cord problems. Newborns can have many types of spots, including milia, baby acne, and blotchy skin. Milia. Tiny white or yellow bumps that look like pimples. Usually appear on the nose, but can also appear on the face, scalp, or chest. Go away on their own within a few weeks. Don't try to pinch or scrub them. Baby acne. Small, inflamed bumps that appear on the face, neck, back, or chest. Usually develops within 2 to 4 weeks of birth. Clears up on its own within a few months. Wash the skin and apply a neutral, perfume-free emollient cream. Blotchy skin. Red blotches with tiny bumps that sometimes contain pus. Usually go away on their own within a week. If they don't, your doctor will want to look at them. Spots and rashes are very common in newborn babies. They may come and go, but if you also notice a change in your baby's behavior, for example, if your baby is not feeding well, or is very sleepy or very irritable, tell your midwife or GP immediately. Quite often, a newborn's breasts are a little swollen and ooze some milk, whether they are a boy or a girl. Your newborn's genitals may appear swollen initially but will look normal within a few weeks. Baby girls also sometimes bleed a bit or have a white, cloudy discharge from the vagina. All this is caused by hormones passing from you to your baby before birth. Do not be concerned. Boys' testicles develop inside their body and sometimes take a while to descend into the scrotum. A health professional will check whether they have descended as part of the newborn physical examination. When caring for a newborn's breasts and genitals, the key is to keep the area clean and dry, using only warm water and a soft washcloth, and avoiding any harsh soaps, lotions, or powders. Gentle cleaning is crucial, and you should never squeeze or massage the swollen breasts to prevent infection. Consult your doctor if you have any concerns about your baby's genital or breast appearance. Jaundice in a newborn is a condition that causes the skin and eyes to appear yellow. It's usually harmless and occurs because a baby's liver isn't fully developed. Symptoms: yellowing of the skin, especially on the face and head. Yellowing of the whites of the eyes. Sleepiness. Poor feeding. Dark yellow urine. Pale stools. Treatment: phototherapy, a treatment that involves placing the baby under special blue lights to help their liver get rid of excess bilirubin. Exchange transfusion, a procedure where some of the baby's blood is replaced with fresh, donated blood. Breastfeeding more often encourages bowel movements, which helps the baby get rid of bilirubin. It's common for a newborn baby to have some swelling and bruises on their head, and perhaps bloodshot eyes. This is caused by squeezing and pushing during birth, and is particularly common in babies who have been delivered by forceps. It will soon disappear, but if you're worried, you can ask your midwife about it. Common areas: bruising can appear on the head, face, and scalp, with potential swelling around the eyes. Causes: the pressure exerted during delivery, sometimes compounded by the use of medical instruments like forceps or vacuum extraction. Appearance: these may look like red marks, small blood spots, or areas of slight swelling. When to consult a doctor: large or concerning bruises, if the bruising is extensive, located in unusual areas like the abdomen, or accompanied by other symptoms like lethargy or difficulty breathing, contact your doctor. A newborn choking while breastfeeding is often caused by a mother having an overactive letdown, meaning milk is released too quickly, overwhelming the baby's ability to swallow, leading to choking, gagging, or pushing away from the breast. This can be managed by trying different breastfeeding positions, hand expressing some milk before feeding, or consulting a lactation consultant if the issue persists. Key points about choking while breastfeeding. Main cause: overactive letdown, where a large amount of milk is released rapidly at the start of feeding. Signs of choking: baby may cough, gag, sputter, pull away from the breast, or make choking noises during feeding. What to do if your baby chokes while breastfeeding? Adjust feeding position. Try holding your baby more upright to slow down the milk flow. Hand express before feeding. Release some milk from your breast before latching to lessen the forceful letdown. Switch breasts frequently. This can help regulate the milk flow. Nurse from one breast per feeding. Focusing on one side can help manage a strong letdown. Pace feeding. Allow your baby to pause and catch their breath between sucking.